All right, welcome to the explainer. Some things come back every single year like clockwork, and one of them is the flu. So today, we're going to break down everything you need to know for this upcoming season, right here in this guide. Yep, it's that time again. So, are you really ready for the 2025-2026 flu season? Let's get you there. We're going to cover what the flu actually is, why it's a way bigger deal than you might think, and, most importantly, what the game plan is to keep you and your loved ones safe and healthy. All right, first things first. What exactly are we talking about when we say the flu? I mean, it's so easy to just throw that term around for any old bug that knocks you out, right? But the flu is actually a very specific intruder. So here's the official word. Influenza, or the flu, is all about, well, influenza viruses. It's not the common cold. It's definitely not a stomach bug. Nope, this is a contagious respiratory illness that zeroes in on your nose, your throat, and sometimes even your lungs. And the thing is, it can range from, ugh, I feel awful, to something much, much more severe. You know the feeling. Am I getting sick? With a cold, it kind of sneaks up on you, right? A little scratchy throat, maybe a sniffle. But the flu? Oh no. The flu doesn't sneak. It kicks down the door, it hits you fast and hard. We're talking high fever, serious aches, just bam, you're down for the count. And telling the difference, that's super important for knowing how to react. Okay, so we've established it's not just a bad cold, not even close. But just how serious are we talking? Let's dig into the real threat it poses every year. So how does this thing travel? Mostly it's airborne. An infected person coughs, sneezes, even just talks, and boom, these little virus-filled droplets are in the air. Then they can land right in the mouths or noses of people nearby. But here's the crazy part. You can be spreading the virus a whole day before you even have a clue you're sick. Yeah. And less often, you can pick it up by touching a surface and then your face. It's sneaky. Okay, check out this number, 8%. On average, that's the slice of the US population that gets sick from the flu each season. Now, 8% might not sound like a blockbuster number, but think about what that actually means. We're talking millions upon millions of people. This isn't some fringe thing, it's a massive annual event. And here's where it gets really serious. For most of us, the flu is a miserable week or two, but for some people, it's a whole different ballgame. We're talking about folks 65 and older, little kids under 5, pregnant women, and anyone dealing with a chronic condition like asthma or diabetes. For them, the flu isn't just the flu. It can be a trigger for severe complications, things like pneumonia, that can be life-threatening. And if you need proof, just look at this stat from the CDC. It's staggering. During recent flu seasons, 9 out of 10 people who ended up in the hospital with the flu had at least one of those underlying health conditions we just talked about. Let that sink in. 9 out of 10. So for a huge group of people, this isn't just an inconvenience. It is a massive, serious threat. Okay, so we've laid out the problem, and it's a big one. So what do we do about it? Let's talk about our number one weapon in this fight, this season's vaccine shield. Look, the message from every health expert out there is crystal clear. The single best thing you can do to protect yourself is to get the annual flu vaccine. It's your first and most important step. And it's a 2-for-1 deal, really. First, it can straight up prevent you from getting sick. But second, even if you do get the flu, being vaccinated can make it a much milder illness, which is huge for keeping you out of the hospital. So how do they even make this vaccine every year? Well, you can think of scientists around the world as flu detectives. All year long, they're collecting clues and tracking which flu strains are popping up. Then, they make their best educated guesses about which ones are going to be the main villains for the upcoming season. And what you're seeing here? This is their conclusion for 2025-2026. These specific strains of H1N1, H3N2, and B/Victoria are the ones they're targeting. Now, here's a big change for this season. All the flu vaccines are now trivalent. That just means they target 3 viruses instead of 4 like they have in recent years. So, why the change? Well, that 4th strain, a B virus called Yamagata, has basically vanished. It hasn't been seen anywhere in the world since March 2020. So scientists decided to remove it to focus the vaccine entirely on the strains that are actually out there making people sick. It's just a smarter, more targeted approach. And here's some more new and pretty awesome news, especially if you're not a fan of shots. The FluMist nasal spray vaccine, it's now FDA approved for self-administration. That's right. For eligible people between 2 and 49, you can actually give it to yourself. That's a huge step for making vaccination way more convenient. Okay, And this is a really important update for a lot of people. For years, there's been confusion around egg allergies and the flu shot. Well, that confusion is over. The guidance is now simple. Even if you have an egg allergy, you can get any flu vaccine that's appropriate for your age and health. That's it. That barrier is gone.
So, the vaccine is absolutely your main line of defense, but it's not the only thing you can do. Let's talk about the other layers of protection, plus what to do if you end up getting sick anyway.
And a lot of this stuff is going to sound familiar because it just plain works. Simple things. Avoid close contact with sick people. Cover your coughs and sneezes. Into your elbow, please. Wash your hands often. And maybe crack a window to let some fresh air in. None of this is rocket science, but these simple habits are incredibly powerful at stopping not just the flu, but all kinds of bugs.
But what if, despite all your best efforts, you still get sick? The key thing to know is that you don't just have to ride it out and suffer. There are prescription antiviral drugs that can help. The catch is, they work best when you start them within the first day or two of getting sick. They can make the illness shorter and milder, which can be a real game changer.
Now, this is maybe the most important part of this whole explainer. You need to know the emergency warning signs. For adults, if you see any of these, difficulty breathing, chest pain that doesn't go away, confusion, seizures, this is not a wait-and-see situation. This means you need to get medical help right away, seriously. And it's critical to know that the signs can be different in kids. So for parents and caregivers, pay close attention. If you see fast or troubled breathing, if their lips or face look bluish, if they're not interacting with you, or they have a super high fever, these are all red flags. Don't hesitate. Get help immediately. Okay, we have thrown a lot of information at you, so let's boil it all down. What are the key actions you need to take to stay healthy this flu season? Here's your checklist.
It really comes down to these 4 simple but powerful steps. 1. Get vaccinated. That is your foundation. 2. Practice those everyday prevention habits we talked about. 3. Know those emergency warning signs, both for adults and kids. And 4. If you're at high risk and you think you have the flu, call your doctor right away to talk about treatment. That's it. That's the plan.
You know, the flu virus is a tricky opponent. It's a master of disguise, changing its look every single year. That's why we have to be ready every single year. So now you know the plan. The question is, what are you going to do? What's going to be your first line of defense?